On the 29th of April, the Food Safety and Standards Authority of India flagged 32 fresh cases of food business operators or food manufacturers, as we may call them, making misleading claims and advertisements. The regulator also stated that a total of 170 such cases have been reported in the last 6 months. While the regulator did not take any names, it stated that the violators include makers of nutraceutical products, refined oils, pulses, flours, milk products, and ghee. It asked them to refrain from making such claims and ads in the larger consumer interest and avoiding enforcement actions. This happened days after a social media influencer had made certain allegations against health drink bournvita's health attributes.
Bournvita. Many of us have been drinking this for more than 10 years, so let's review it for 1 minute.
The chain of developments therefore are of particular importance because claims, both correct and incorrect, and advertisements of the kind exist everywhere around us.
Food advertising is one of the more violative sectors. If I just look at even what we are doing at the Advertising Standards Council, food is only one of the categories we look at. We see that close to about 10% of the ads that we look at. So if I just see the number that I have last year, it's close to 788 ads that we have processed against food advertising, and close to, I think, about 299 are related to influencers. So we still have close to around 490 ads where the content of what was being said in a food ad was found to be misleading. And then, of course, as I said, the 200 odd ads which are just non-disclosure of influencers when it comes to food advertising. So food advertising is certainly pretty much part of the overall narrative on advertising, and particularly when it comes to misleading advertising.
Now, making deceptive claims is recognized as a punishable offense under Section 53 of the Food Safety and Security Act 2006. The Food Safety Regulator asks that the ads and claims must be truthful, unambiguous, meaningful, not misleading, and help consumers to comprehend the information provided. And all of it must be scientifically substantiated using validated methods. Most importantly, regulators in India are very particular about the use of words that you may very commonly hear in ads. For example, natural. You use natural for a single food product which has been derived from a natural source and has nothing added to it. It has only been processed to make it suitable for human consumption. The packaging too is without any chemical and preservatives. Composite foods that are a mixture of plant and processed constituents cannot be called natural. Instead, they can be said to be made from natural ingredients. Second in line is pure. Pure can be used to refer to single ingredient food products to which nothing has been added. Unavoidable contaminations that are also aimed at preserving the quality or keeping it safe must be within prescribed controls. There is no space for avoidable contaminations. Compound foods cannot be described as pure but can be said to be made with pure ingredients if they meet the criteria. Then is fresh. Fresh is used for products that have not been processed in any other manner except for washing, peeling, chilling, trimming, cutting, or any other processing such that it remains safe for consumption with basic characteristics unaltered. However, if the processing tries to extend the shelf life of the product using additives, the reference cannot be used. Instead, it could be contextualized as freshly frozen, frozen from fresh, basically implying that it was quickly frozen while fresh. Then is original. Now, original can be used when the food product is made to a certain formulation, the base ingredient or the product of which can be traced and has remained unchanged. It may similarly be used to describe a process that has essentially remained unchanged over time, although the product may be mass-produced. Then are nutritional claims. Now, nutritional claims can be about the specific contents of a product or comparison with other foodstuffs. For example, such as this product of gives as much energy as certain food or has as much nutrients as another food. Now, here it is of particular importance that the claims of equivalence are properly established.
A lot of claim data is based on technical data. When you, let's say, for example, say that, I have vitamin D in my product,
Mm,
we need evidence that it is there in your product. Then if you claim that, this vitamin D in my product can make you XYZ, or let's say reduces fatigue, or, improves stamina or whatever, then one is if the claim is, credited to the ingredient, then there needs to be enough literature to say that the ingredient does this. So there is evidence of ingredient that they need to provide. However, if the claim is that my product makes you do this, which means that the composition of the product with all its elements,
mm,
which is the base elements, all the vitamins or whatever the product may have, as a composite unit work.
mm,
So then they have to, in most of these cases, then provide clinical evidence to say
mm.
that, this product has been tested, and, then there is a control group, there is a group to which this product was given. This is the period where the, outcomes are observed. So whatever is the nature of claim that you're making needs to be substantiated through evidence.
Important to remind here that the claim must be fashioned in a way such that the viewer is able to correctly interpret it.
There was a brand which says that, my product gives you the energy of a glass of milk. Okay.
Hmm,
Uh, Now, from a kilocalorie point of view, that claim was correct. So if a glass of milk had, let's say 200 calories, their product also had 200 calories, and therefore technically energy as measured through calories
hmm,
was correct. Their claim was correct technically.
hmm,
But the jury says that when you say that product XYZ has the same energy as a glass of milk, from a consumer point of view, when you talk of energy, energy
hmm,
from for a consumer is not measured in terms of kilocalories, it's measured in terms of the body's ability to do certain tasks, or to be energetic, or to be, to have that as an outcome of the body, not as an
hmm,
input in terms of kilocalories. So, obviously a more nutritious food will give you more energy as far as the consumer is concerned. And
hmm.
therefore, even technically that claim was correct. We said that that advertisement had to be modified because a consumer's understanding of the word energy is different from the technical understanding of the word energy.
For more such videos and from news from India and around the world, please subscribe to The Hindu. Thank you for watching.